Hi, I'm Dr. Mike Milligan. I'm here with Trish O'Hehir, a registered dental hygienist from Phoenix, Arizona, also an expert on airway and breathing, like mouth breathing problems and things like that. Trish, thank you so much for being with us.
It's my pleasure. Thanks for the invitation.
Now, so many people have no, I used to be a mouth breather. You used to be a mouth breather. So many people are and don't know that it's a problem. Tell us some of the problems with breathing through your mouth instead of your nose.
Well, there are lots of problems, as you and I both know. It'll first of all dry your mouth out. You can have bad breath. Some things that people don't know is that it actually reduces how much oxygen reaches your brain and your muscles. And if you breathe through your nose, you'll actually get 18% more oxygen to your brain and your muscles than if you breathe through your mouth. Also, the mouth doesn't filter anything, so if you're having problems with allergy, and if there's viruses around, you're going to breathe those right into your lungs directly if you breathe through your mouth. You won't get any filtration.
Sure. Well, now this affects this oxygen level. What percent did you say?
You'll have 18% more oxygen reaching your brain because your nasal passages actually produce nitric oxide, which is what helps to convert that oxygen or allow it to be absorbed.
Right. It changes the whole biochemistry of your body. So this affects your brain, your muscles, really every organ in your body. It
really does, because when you're breathing through your mouth, your whole body is oxygen deprived. And if you think of small children, they need oxygen for brain development, and they need oxygen for getting a good night's sleep. Otherwise, they may sleep 10 hours straight, but they're not in a regenerative level of sleep. So they're going to wake up completely exhausted and
What about adults? What does it do for them?
For adults, they actually have a restless time sleeping and often waking up several times during the night. For me, I noticed that and didn't know it was the mouth breathing, and I bought 3 new mattresses, always taking one back because nothing changed how I was sleeping until I actually closed my mouth and started breathing through my nose, and then I didn't need a new mattress. I slept just fine.
And then, of course, if you don't get your rest, it affects your whole day.
Yes, and for kids, it affects how well they do in school. They become tired during the day. Their behavior problems that come up. For adults, they can be fatigued and then go for that coffee and a piece of chocolate at 3 in the afternoon because they're just exhausted. So those are some of the signs.
Well, why do people breathe through their mouth instead of their nose? How does this start?
That's such a good question, because we're born to be nasal breathers, and infants, when they're born, can actually breathe through their nose and swallow at the same time. So there's not a problem there. But usually what happens are habits that can cause you to switch from nose breathing to mouth breathing. Thumb sucking, it pushes the tongue down, not necessarily that you're going to be an open mouth breather, but for infants who are tongue-tied, that's going to push them down. And when the tongue doesn't go up to the roof of the mouth, it makes swallowing difficult, and that then leads to the mouth breathing. Having allergies, asthma, a cold. For me, I remember back that I had a bad case of bronchitis, and I was so stuffed up I couldn't breathe. And after that, I always had to have water by my bed because I would wake up in the night with a very dry throat because of the mouth breathing. Well,
the other thing is, if you do the mouth breathing and your adenoids and tonsils begin to swell, you get allergies, then it's a cycle.
It's a vicious cycle, And
then if you don't know you're supposed to breathe through your nose, you just get in the habit then of breathing through your mouth.
And then you believe that it's impossible to breathe through your nose because you've always been breathing through your mouth. My older brother was a mouth breather his whole life, and no one ever even suggested that he should close his mouth and breathe through his nose. It was just, oh, he's a mouth breather, and people accepted it as normal, which it really isn't now.
Changes your whole dentition, your arches get smaller, you get crowded teeth. So what do you do about it?
Well, before I go to that, I want to add to what you just said about the arches. What happens when you're a mouth breather and your tongue is down and forward, you swallow differently. When your tongue's on the roof of your mouth, if you try it right now,
which is where it's supposed to be.
Exactly, when you swallow right now, the tongue pushes. And we swallow 500 times a day at least, and that's an orthodontic appliance that then every time you swallow triggers the DNA and the stem cells to make that palate grow. So that's how that works. And the mouth breathers don't have that benefit, so they get that narrow, high vaulted palate and crooked teeth.
And then it makes the problem even worse. It feeds itself. Then they continue, their airway isn't as big because the roof of the mouth is the same bone as the floor of the nose. So then it just continues to have you a narrow airway, but there are ways to correct that. So what do you do if you're a mouth breather?
The first thing is to really find out that you're a mouth breather. And when you do realize that, then you want to just check, breathe in and out on each side of the nose to make sure you can breathe through the nose. Right. And another way to help that is with the xylitol nasal spray in the nose. Knowing that you can breathe through the nose, then it's sometimes hard to just close your mouth all the time. So a piece of white medical tape, it's just micropore paper tape that you can get in the drugstore right across the lips, will
be great for kids.
Yes.
Oh, I'm kidding. Okay.
I think every child in the back seat should have it.
But you're right.
In the car, yeah.
Yeah, exactly. But so it was surprising to me to learn that actually all of the major airway educators and all actually have people tape their mouth closed, so that if you want to breathe through your nose, breathe through your nose. If your mouth's taped shut, you have to breathe through your nose.
And what it does when the mouth is taped shut, it sends a different signal to the brain, because then they're breathing in and out through their nose, and that slows the inhale and exhale, and the brain goes, oh, they're at the right pace now, I don't need to plug the nose up, because when they're breathing through their mouth too quickly in and out, the brain is trying to slow the breathing down, but thinks they're exhaling through their nose, and it's not. Two different respiratory centers in the brain. One recognizes nose versus mouth, but the other doesn't, and triggers the goblet cells to send more mucus, and that plugs the nose up. So the mouth breathing does actually keep that cycle going of plugging the nose up and congesting the person.
You've mentioned two things. You mentioned a xylitol nasal spray to keep your nasal passages open, and you mentioned taping your mouth closed and first being aware of it all. What else?
Another good thing is to connect with your dental office and a myofunctional therapist if you can, to learn some exercises, because that tongue isn't very strong. It's been down and it needs to be up on the roof of the mouth. So that'll take some practice and some time, but just like any body part, if you haven't been using it enough, by the time you do some exercises and retrain it, it doesn't take long, and it's easy then to keep the tongue to the roof of the mouth.
So they can Google orofacial myologist. Okay.
That's a good way, and to go to the dental, ask your dentist and hygienist if they know.
Okay. What if you just can't breathe through your nose? I mean, taking your mouth shut, you can't breathe through, you got a problem.
Big problem.
So what do you do if you can't breathe through your nose?
Well, first thing, don't tape your mouth if you can't breathe through your nose. Okay, so don't do that. Okay. There's a quick way that the nasal spray will help to pull fluid out of swollen tissues. And then there's another quick trick you can do by just putting your fingers on your lips, take a little breath in through your nose, little breath out, pinch your nose, hold your breath, bob your head up and down, count to 10 or 15. When you have to take a breath, keep your finger over your lips and take that breath in through your nose. And that will send the signal to the brain to unplug the nose. So you can do that 6 times in a row, and just that little exercise will help to unplug the nose if it's simply related to the congestion. If it's a physical deformity,
how often do you do that?
You can do that 6 times in a row if you need to.
6 times in a row, and then wait for how long to do it again?
About 15 seconds between each one, and sometimes on once or twice through, and you can actually already feel that you're.
Okay, so that's a trick. If physically, mechanically, you're able to.
Right.
What if you can't?
If you really can't, then and you've tried the exercises and the nasal spray, the next thing is being referred to an ENT.
Right. Okay. Great. Wonderful. Tell me a little bit about this taping your mouth closed. At night is really, first make sure you can breathe through your nose, and then at night is a good time to do that. Right,
and just doing it one night will help you realize whether or not you're a mouth breather, because if you have a good night's sleep with your mouth taped, it shows you that you weren't getting enough oxygen during the night. So it's a good test that you can do in a single night.
Where can we get more information about this, Trish?
A good place to get more information is to ask your dentist and dental hygienist.
Great. Trish, thank you so much for being with us.
My pleasure. Thank you.